the way we handle this is, it has to do with getting people to agree to time. When we go through a treatment plan with people at a report of findings, it's all about getting a patient to say yes to time, that they're coming in, to see you so many times per week. And the challenge we have as chiropractors is, if you could email someone or text someone their adjustment for free, that's what they would want. Joking aside, I mean, the reality is people don't want to spend 6 months with us or a year with us. They don't want to do these things and they don't expect it necessarily. But meanwhile, you're going to try to talk to them about they need 6 months of care or 8 months of care or a year of care. And they're going to come in 3 days a week, etc. And they're going to freak out. And this is why many chiropractors shy away from doing care plans. They don't do them because they don't know how to communicate about time, and they're met with tremendous rejection. So instead of doing care plans, they do what they think they can do, which is one visit at a time or a few visits at a time. And it sabotages the patient, it sabotages the practice. So you got to get good at communicating time to people in a way that it's easy for them to say yes to. So jumping to the part of what you're asking about, instead of going through a treatment plan of saying to someone, hey, Tony, we're going to start you up for 3 days a week and go to twice a week and yada, 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 like we typically do, which is to start from the present and move forward in our treatment plan, that's a mistake. What we do instead is we do it in reverse. We do it in reverse. We start with the end and work backwards. So let's say Erica was my patient. I say, Erica, we know that the goal of care is to get XYZ, whatever the goal is. The good news, when we reach that goal, I won't need to see you very much. I'll see you as little as maybe once a month, could be as much as once a week, but I don't need to see you very much. But to get to that point in time, we're going to see you more frequently during that for a few months. We're going to see you twice a week. But Erica, here's what I want you to focus on. Every month, I'm going to measure your progress. We're going to redo your testing. And I've been doing this for a long time with patients, and I know exactly the progress you should be getting along the way. I know what goals you should be reaching after 1 month, after 2 months, after 3 months. I know where you should be. And as long as you're reaching those goals, and you've made the progress that I anticipate, then the plan I'm telling you today is exactly the plan we'll stick with. And if for some reason you're not reaching those goals, we'll evaluate, we'll figure out why, we'll make changes, even if I have to refer you somewhere else. That's what it'll take to get these results. Now, Erica, when you came in yesterday and I was doing your evaluation and I was, getting to know you, as I was getting to, hear your story, what's going on and evaluate it, I kind of got the sense from you, it's important to you to feel better as fast as possible. Am I accurate in that assessment? And Erica goes, yeah, totally. I want to feel better tomorrow if I can. So here's what I recommend we do. The good news is to get the results, I don't need to see you more than twice a week. We could start off with that and you're going to get great results in the time period that I outlined. But if you want to feel better faster, here's what I'd recommend we do. That we actually go above and beyond what's required to get the results and have you come in 3 or 4 days a week these first few weeks. And what that'll do is it'll speed up the process of you feeling better. It's not a requirement to do this, but I'd recommend to do it if you'd like to, and that'll help you feel better faster. I'll leave that up to you if you'd like to do that. So I'm going to pause here for a second. And I never say what I just said exactly this. It's not a script. There's no exact words I'm using here. But the process I'm going through is starting with the end to let the patient know there's an end. There's a goal to be reached, and I don't need to see them very much. When I talk about the middle of care, which is typically the twice a week type of schedule, that portion of care, what I'm getting them to focus on is not so much the frequency. I'm getting them to focus on the fact that I'm measuring their progress. I'm reporting back to them on the progress, and that as long as they reach the goals that I anticipate, we'll stick with that plan. And when it comes to the beginning of care, what you often refer to as the relief phase, and I don't encourage you to use that term. I encourage you to stay away from those terms. But if that's that period of time where they're coming more frequent at the beginning, I suggest you don't make that a requirement. You simply present that as a benefit to them that if they want to feel better faster, they come in more frequent at the beginning. And let me clarify what this does for you. It removes you being the pain doctor, because the purpose of your care that you outline is to get the results. It's not to make them feel better. In fact, I don't say this to a patient, but my attitude is I don't care how fast they feel better. That's not my job. My job is to get the end result. Them feeling better is part of the process. If they want that to happen faster, I will do them a favor. I almost have this attitude of, and I don't say this to a patient, but my attitude is I'm going to do them a favor and let them come in more than what's required so they get something that's important to them, which is to feel better quicker. I don't care whether they do it or not. That's not my intention. That's not my goal, is to make them feel better. My goal is to get the end result, whether that's restoring their cervical curve or whatever it may be. So my point being is when you start with the end and work backwards, it makes it easy for a patient to say yes to care. That's one piece of this. I just gave you a small snippet of the entire process, but that's an example of how we do things differently than what you've probably traditionally been doing in your practice when it goes through going through a treatment plan. It makes it much easier to get a patient to say yes to your care plan or yes to your treatment plan, I should say, prior to you having your finances gone over. And I'll wrap up with this portion of it. Doctor, it's your job at a report of findings to get yes to time, which is, I just gave you a little snippet of that. That's your job. It's the CA's job then to take that patient and go over finances with them with their care plan.